All right, for the anterior drawer test, there are no other names. The ATF and the calcaneofibular ligaments are tested. A positive would be pain over those two ligaments or laxity compared to the other side. The proper patient positioning would be the patient seated with the knee slightly flexed about 30 degrees to eliminate the gastroc if there's any tightness, with the ankle or foot hanging off the table. I'm going to stabilize the distal lower leg, and my stress point is going to be on the posterior calcaneus, and in one quick motion I'm going to pull an anterior force from behind the calcaneus away from the tibia and fibula, and any compensations would be if the leg is straight, the gastroc could be tight, limiting your motion and limiting a good test. With the anterior drawer test, I have her leg underneath the pillow to bend the leg to 30 degrees just about to eliminate the gastroc if it would be tight. My stabilizing hand on the distal lower leg and the bottom of her foot on my forearm with my hand on the calcaneus, and in one motion I'm just going to apply an anterior stress to test the ATF and CF. Hoffa's test does not have any other name. It tests for calcaneal fracture. A positive would be the affected side, the Achilles tendon, being less taut than the unaffected side when the patient actively dorsiflexes and plantar flexes. The positioning would be prone with the feet off the table. There's no stabilization needed. Stress point would be have both hands on the Achilles tendon, and the movement have the patient actively dorsiflex and plantar flex, and the positive would be less taut on the affected side. All right, for Hoffa's test, the patient's prone with her feet off the table, and I'm just going to palpate the Achilles tendons while she plantar flexes and dorsiflexes the feet, and they both feel the same, so this is a negative. The Thompson test, other known names are the calf squeeze test. It tests the integrity of the Achilles tendon. The positive test would be no movement of the foot into plantar flexion with the squeeze of the calf. Proper patient positioning would be prone with the foot off the table, or on the field, just the foot off the floor, and being able to squeeze the calf. There's no stabilization needed. The stress point is just the mid-belly of the calf on the sides with your hand, and for the clinician, you just squeeze the calf as the movement for the test. All right, with the Thompson test, the patient's prone with the foot off the table, and I'm just going to find the mid-belly of the gastroc and soleus and squeeze, and there is plantar flexion in the foot, so this is a negative test.